Hi, I'm Dr. Bertalan Mescu, the medical futurist, and today I want to talk about leadership during the time of crisis. It's been a while since the world faced a generation-defining crisis like this, and in the pre-COVID-19 world, while we were blinded by our fast, self-centered lifestyles, it was easy to ignore or turn a blind eye to catastrophic economic decisions, defunded healthcare systems, and outright suicidal environmental policies. While we didn't pay attention, a whole class of incompetent politicians have come into power. But now, as we strive for real answers and real solutions, there are those who rise to the challenge and show us what real leadership is.
When you have a respiratory illness that can be spread from person to person, and you have something that's global, and you have jet travel, nowhere in the world is completely safe when there's an epidemic raging in one part of the world. And since that's going on in China, we need to continue to be very vigilant.
At times of crisis, we all need honest, scientifically based, real facts to bring us focus, hope, and clarity. In the US, Dr. Anthony Fauci has become the poster figure of such scientific realism. The 79-year-old physician and immunologist who started his governmental service under Ronald Reagan is the director of the National Institute of Allergy and Infectious Diseases, and his daily appearances as the lead member of the White House Coronavirus Task Force gave him an unexpected superstardom. Why?
I'm not totally sure of what the president was referring to, but I believe he's referring to a report that used both hydroxychloroquine and azithromycin together to have some possibility of being an effect. Many of the things that you hear out there are what I had called anecdotal reports.
That is why he's a person who does his job and doesn't care about the consequences. He often confronts the lies of President Trump live during press briefings. He contradicts the White House's official narratives when they are inaccurate or outright lies. And he goes out of his way to give interviews for every segment of the media to bring real clarity to the Americans. Hopefully, he can keep his job and continue his crucial work in this age of misinformation, when fake news can even come from the president himself. Einstein was the undisputed scientist rock star of his time. Today in digital health, that's Eric Topol. He works on genomic and digital innovative technologies to reshape the future of medicine, and wrote 3 best-selling books about the future of healthcare. Due to his expert analysis and remarks, he has become a thought leader on COVID-19 over the past few months.
We can do the digital surveillance tomorrow if we had, a national support, and it's cheap relative to heart rate by smartwatches is quite accurate. And again, it isn't at the individual level. We're looking for clusters of people where their heart rate is changing, resting.
Topol has 250,000 people following him on Twitter, and the way Trump uses it to spread misinformation, Topol uses it to bring clarity too to the Americans. He was quick to point out the fact that telemedicine would be essential during COVID-19. He continuously analyzed curves and reviewed possible treatments. Too bad he's focusing on the US only, for we would need someone like him in every single country. The renowned network scientist Albert-László Barabási knew that the pandemic would bring our modern world to a screeching halt months before it happened. He works at the Network Science Institute in Boston, where he and his colleagues were able to accurately predict the spread of viruses for years. They followed Zika, Ebola, and now COVID-19 as well. As he puts it, the coronavirus pandemic is a network problem, so network methodology is needed to predict and ultimately control its spread. Now he uses his resources to find treatment for the disease. Using network medicine, AI, and the fusion of the two, Barabáshi's team named 81 potential drugs in a matter of 10 days that could be crucial. Building a global network to speed up the process of finding the possible vaccine, Barabási made all predicted drugs and network-predicted drug combinations to be freely accessible. Now let's talk about that particular vaccine issue. There seems to be no better person to turn, in this case, than to a brilliant mind, Dr. Larry Brilliant. I know. The epidemiologist who helped eradicate smallpox is absolutely confident that the COVID-19 vaccine is coming. In a TED Talk almost 15 years ago, Brilliant actually forecasted a pandemic pretty similar to COVID-19.
Let me show you a simulation of what a pandemic looks like, so we know what we're talking about. Let's assume, for example, that the first case occurs in South Asia. It initially goes quite slowly. You get 2 or 3 discrete locations. Then there'll be secondary outbreaks. And the disease will spread from country to country so fast that you won't know what hit you. Within 3 weeks, it will be everywhere in the world.
Even if COVID-19 is not as bad as the one Brilliant was afraid of, he still calls it the most dangerous pandemic of his lifetime. And he says by slowing it down or by flattening the curve, as we all learned, we are not going to decrease the total number of cases, but we are going to postpone many cases until we get a vaccine. And he's absolutely sure we will get to that in 12 to 18 months. His prediction is that by then we will hit 2 targets. A large enough quantity of us have caught the disease and become immune, and B, he will have a vaccine. And the combination of A plus B is enough to create herd immunity. But Brilliant's most important prediction is that once we get through this, perhaps this crisis will make us re-examine what has caused the fractional divisions among us, and the trauma of COVID-19 can actually bring us together again.
I'm not so afraid of the virus. I'm much more afraid of the inner demons of humanity coming out, people reacting to this crisis, not with solidarity, but with hatred or with greed. That's the biggest danger we face.
You must know you've reached scientific superstardom if James Corden asks for an interview. Luckily, it wasn't for a sing-along. The comedian called philosopher Yuval Noah Harari on the show to talk about COVID-19's impact on humankind. Harari is recently quoted pretty much everywhere due to his best-selling books. In his interviews, he bluntly speaks about populism and irresponsible politicians who deliberately undermined the trust in public authorities and science.
Traditionally, the US was the responsible adult that in a case like the Ebola epidemic or the 2008 financial crisis stepped forward to be the leader of humanity, and in both cases managed to gather enough countries around it to prevent the worst outcomes. Now the US has basically abdicated its role as global leader.
Luckily, he says, he feels a renewed trust in science despite attacks on it over the past decade. He hopes this trust will remain long after COVID-19 is gone, when scientists will talk about ecological collapse or climate change. In a piece written for Time magazine, Harari calls for an international cooperation and information sharing as well as global solidarity. But without a global leading body, he misses crucial leadership in the handling of the pandemic. He says this unity and mistrust are more contagious than any virus, and there is no vaccine for that. Fortunately, there are a few world leaders too who stand out from the crowd, and at least in their country, they managed to put their faith in science and scientists.
Ich glaube fest daran, dass wir diese Aufgabe bestehen, wenn wirklich alle Bürgerinnen und Bürger sie als ihre Aufgabe begreifen.
Germany, for example, found itself in the middle of the European outbreak, but Angela Merkel's words helped unify Germany behind the government's response. It's a strong contrast between Germany and the US, where some governors are taking matters into their own hands, making their whole crisis management a chaotic mess. Merkel's response to COVID-19 is looked upon with envy around the world. While the country has a large number of confirmed cases, the death toll remains remarkably low and their health system remains robust.
If you're unwell, stay home. If you have a runny nose, a sore throat, a cough, get a test. Let's make sure that we keep those testing rates up. We continue with our contact tracing and isolation. That's how we'll finish this job.
Another great example is New Zealand, a country that had one of the most decisive and strongest lockdowns in the world, yet its people united behind it. That's all due to Prime Minister Jacinda Ardern's masterclass in crisis response. In directing New Zealanders to stay home to save lives, she simultaneously offered meaning and purpose. By freely acknowledging the challenges they all face, she showed empathy. And it worked. Jacinda's decision to pursue the complete elimination of COVID-19 is a vastly different approach to usual pandemic planning, which focuses on delaying the arrival of the virus, followed by a range of measures to flatten the curve. And while the end is nowhere in sight, New Zealand is on one of the most promising trajectories for tackling the virus.
I år markerer vi Europadagen midt i en krise, der har vendt op og ned på alting. En krise fortæller os også, at vi bliver nødt til at finde nogle fælles svar. Det skal vi gøre i Europa. Det er vejen ud af krisen.
As one of the first countries to take action against the outbreak, Denmark was quick to close schools, limit social gatherings, and shut its borders entirely. That's all due to Prime Minister Frederiksen's swift response. And while the Danish were in lockdown, their government still guaranteed 90% of the workers' salaries to prevent mass layoffs. And even in Boris Johnson's UK, where a bad crisis response cost thousands of lives, the Queen managed to remind all of us what the Briton spirit really is. The Queen's speech was like listening to a wartime Churchill. And she delivered everything that's actually needed from a leadership during a crisis like this. She left science to the scientists and instead played her role as a leader. She put things in context, since this is not the end. She thanked and gave her appreciation to everyone fighting on the front lines. She acknowledged the struggle of everyday people who are trying to make ends meet during these lockdowns. And most importantly, she gave hope that everything will be better and life will return to normal eventually. That's all that was needed.
We will be with our friends again. We will be with our families again. We will meet again.
These world leaders have listened to the science and the scientists and were able to manage and overcome the early challenges COVID-19 presented. And all three of these countries are now cautiously starting to reopen their economy. At the same time, politicians like Trump, Johnson or Bolsonaro, who place the economy above their people's well-being, are not just suffocated by the high death tolls, but in the case of the US, the economy might not be fully restored until the second quarter of 2022. Coming out of this madness, I can only hope we won't forget the true face of our leaders in the time of crisis and make our choices accordingly. If you like this video and want to hear more about how our lives will change after COVID-19, subscribe below. Thank you.